The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Sierra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello. Today, I am going to break down the differences between chronic hypertension, gestational hypertension, preeclampsia, and even something called HELP syndrome, which you may or may not have heard about. And we're going to talk about what they mean, how they are diagnosed, and what it could mean for your birth. So first, I just want to define what the baseline is of normal blood pressure. So 120/80 for pregnancy, the threshold for high blood pressure is 140/90. That top number is called the systolic number. That's the pressure when the heart beats. And the diastolic number is the bottom number, and that's the pressure between beats. So you don't necessarily need to know those things. We're not medical here, but I just wanted to give a basic definition. All of the conditions we're talking about today do involve elevated blood pressure generally, but when it starts, what else is happening, all of those things make them different. So first, let's start off with chronic hypertension. This means that the person either had high blood pressure before pregnancy ever began or sometime in the first 20 weeks. So anything before 20 weeks of pregnancy. It can be pre-existing or identified early on, and usually it means that there's already a present baseline condition, but it could be mild or severe. So it doesn't have to be something crazy high. It could be something pretty mild. Some of the risks prenatally are that there is a higher risk of developing preeclampsia later on, and placental issues can be a part of a risk factor, as well as growth restriction. Sometimes that's called intrauterine growth restriction, or you may hear that called IUGR. Some things to consider postpartum if you have chronic hypertension are that blood pressure increases usually continue after birth, and do usually require ongoing management. And then this doesn't mean that somebody needs an automatic induction. That's really going to depend on the severity, if they're on medications for it, and their overall pregnancy health, how well the baby is doing. So chronic hypertension in and of itself doesn't automatically mean anything is like super wrong. It just means that the providers are going to be monitoring things a little bit more closely. Then we have gestational hypertension. This is where someone didn't have hypertension or high blood pressure before pregnancy, and it develops after 20 weeks of pregnancy. There's usually no other signs of preeclampsia, which we're going to talk about here in a second. And the diagnosis criteria is generally that it's the blood pressure is above 140/90 on 2 occasions. So one high blood pressure reading doesn't mean that somebody's going to be diagnosed with gestational hypertension, but after 2 readings, it can. They do not have any other things like protein in the urine or organ dysfunction, which we're going to talk about when we talk about preeclampsia. Now, gestational hypertension can progress into preeclampsia, and it's actually even being thought that potentially it's just like a when is it going to happen, not if it's going to happen. There is an article out by Evidence-Based Birth that I do recommend going and looking at. I believe they also have a podcast episode about some of the new research about that. But here we're just breaking down what everything is. Some of the risk factors for someone that has gestational hypertension are if it's someone's first pregnancy, it's more likely. If they're having multiple babies, so twins, triplets, or higher order multiples. History of hypertension, higher BMI, so higher body mass index, and age factors. So if somebody is much younger or much older, so on either extreme. And usually this resolves after birth. The gestational hypertension doesn't usually go into the postpartum period, and they will still usually be monitored a little bit to make sure that nothing is extra wrong. But generally, it doesn't need any other issues after postpartum. And for birth, usually they'll do a little bit more of monitoring. There's potential that someone might need an induction if it's closer to their due date, But generally, gestational hypertension is kind of like a watch closely. If it hasn't crossed over into preeclampsia, they're going to pay attention, but nothing necessarily needs to be overtly done about it. Then we have preeclampsia. This is the one that most people hear about when they think about high blood pressure in pregnancy. So this is high blood pressure after 20 weeks and signs of organ involvement. Because remember, the gestational hypertension was high blood pressure after 20 weeks. This one also includes organ involvement. But what does that mean? So the diagnostic criteria, this is like a really simplified version, is it's high blood pressure and one or more of the following. So either protein in the urine, liver involvement, kidney dysfunction, low platelets, neurological symptoms. So some signs that people want to watch out for are if they have a persistent headache, if they have vision changes, so spots or blurry vision, upper right abdominal pain, sudden swelling, especially in the hands and face. And then later in pregnancy, someone may experience nausea or vomiting and also shortness of breath. And it's really important to note here that some people have no obvious symptoms of preeclampsia. Just because someone doesn't have high blood pressure right now doesn't mean that they're not also having some of these other symptoms. And this can be really sudden onset. So somebody could be completely fine one day and then the next day have skyrocketed blood pressure with protein in the urine. Some risk factors for this one are if somebody, again, is in their first pregnancy, if they have a history of preeclampsia in another pregnancy, if they have chronic hypertension, which remember we talked about at the beginning, that is any high blood pressure prenatally before 20 weeks or before you ever were pregnant, any autoimmune conditions, diabetes, and multiple gestation. So multiple babies in there, twins, triplets, and so on. And then a lot of people don't realize that preeclampsia can happen during pregnancy, but also there's postpartum preeclampsia, which can develop after birth, up to 6 weeks after birth, and it's often overlooked. I actually used to think that I was like, how can somebody have preeclampsia postpartum? Because it's postpartum, not prenatal. But preeclampsia, the pre part doesn't mean prenatal. It's before eclampsia. So this is something, if someone feels off, like especially headaches, vision changes, it's not something to ignore. And someone may want to be taking their blood pressure postpartum, like have a little blood pressure cuff at home. That's not a bad idea. Not a bad idea for during pregnancy either. With preeclampsia, really the only cure is delivery, but the timing of that delivery is really a careful balance, whether or not your provider is going to want to induce you. And it's also funny because with preeclampsia, you're like, oh, well, the cure is delivery, but what if it was postpartum preeclampsia, right? I already delivered. Why is this an issue now? But it is something that can rear its head later. I actually had a client not very long ago have like picture perfect in her head birth, right? She had an spontaneous, so no induction, spontaneous vaginal delivery. And she did a completely unmedicated birth in the birthing suites at a hospital with like low intervention room, midwifery care, no postpartum Pitocin. Everything went exactly as planned and very fast, actually. 1 week after she was home, she had sudden onset postpartum preeclampsia, ended up having to be admitted back to the hospital, and she had to be on a magnesium drip for 24 hours. So this is something that really can happen to anyone. And then there's another thing I really want to bring attention to called HELP syndrome, which is something that not a lot of people have heard about. This is a condition that I don't want to scare you by talking about it, but I do want to help you understand and recognize when something needs immediate attention. So HELP is considered a severe form or complication of preeclampsia. The acronym HELP, HELLP, is hemolysis, which is a breakdown of the red blood cells. The EL, the next ones, are elevated liver enzymes, and then the LP is low platelets. This affects multiple systems of the body, not just blood pressure. It's most commonly in the third trimester, but it also can occur postpartum. And just like preeclampsia, it can show after they go home from the hospital, after you go home from the hospital. So just doesn't mean that you're completely out of the woods, although it's not as common. So some symptoms for people to look out for are upper right abdominal pain under their ribs, which can be a little bit confusing because babies push up there, right, with their little feet and things like that. So there are people who have rib pain and like stretching pain under their right abdomen, and they're like, wait, Is something wrong? Do I have this? It's always better to get checked out than to just ignore a symptom. Shoulder pain, which can be referred pain from the liver, nausea and vomiting, especially in later pregnancy, headaches, and a general feeling of just being unwell or something is off. And then swelling can happen, but again, not always. High blood pressure can be present, but isn't always severe. So people think that because this is a severe form of preeclampsia, that maybe that means everything else will be elevated, but it doesn't necessarily mean that the blood pressure is extremely, extremely high, but it would be elevated. And one of the biggest red flags of HELP is really just somebody saying like, I feel off. Something does not feel right. Always go get checked out. It just does not hurt to go get, an all clear. So risk factors are a history of preeclampsia, any previous HELP syndrome. I had a mom that had HELP syndrome with her first and ended up delivering at 28 weeks because of it. And then her next 2 pregnancies, she didn't have that case at all. But it can increase your risk factors. Chronic hypertension. So what does this mean for someone's birth? HELP is considered a medical emergency. That one is going to usually mean a pretty quick delivery. Depends on the timing and severity, but this isn't really a wait and see situation. This is like okay, that's it. Let's have a baby now. So things to think about here from a doula's perspective, a doula isn't going to diagnose anything. So I want you to really think about your doula doesn't need to have experience with having somebody have gestational hypertension or preeclampsia or HELP syndrome to be able to help you through this process. But a doula is going to be there to help you trust your instincts, help you ask for evaluation, advocate for being taken seriously, think of questions to ask your provider. So those are things that your doula can help you with. So a little breakdown again, chronic hypertension before pregnancy or before 20 weeks. And gestational hypertension is anything after 20 weeks of pregnancy, but it's only high blood pressure. There's no other symptoms. Preeclampsia is after 20 weeks of pregnancy. And so having high blood pressure then and organ system involvement, so liver, kidneys. And then HELP syndrome is multi-system dysfunction and usually requires immediate medical attention. I think that it's important to remember that you do not necessarily have to be induced for all of these situations. It's going to depend on the diagnosis, the severity, the gestational age that you're at, and then also the baby's status. So if baby is doing really well and the severity is low, it's going to be a lower chance that your doctor is going, or doctor or midwives or whoever are going to want to quickly have you deliver. It's really not a one-size-fits-all thing, and they're really weighing multiple factors here. So doulas also can help support around inductions, unexpected change in plans, navigating the hospital conversations, and really just asking informed questions, because that's one of the biggest pieces that people struggle with is what do I even ask? You go into those appointments and you get these big things and big news, and then it's really hard to formulate those questions in the moment. So, hopping on a phone call with your doula before or after those appointments, and you can always send follow-up questions through your patient portal as well. A diagnosis doesn't take away your autonomy. It just changes the conversation. So I just wanted you to think about those things. I want you to know your body is not failing you. Sometimes we just need a little bit more support and attention, and it can be a really big shift in our plan. But just because one thing changes in your birth plan or preferences doesn't mean that everything else has to go out the window. I hope that this was helpful and helped you understand a little bit more about the difference between these conditions. And I would love to hear what else you'd love to hear us talk about. Thanks. Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.